Well, matchmakers are known to help singles find love, but can a matchmaker also help someone with their mental health journey? Thank you for staying with us. I'm Erin LeBeau.
And I'm Tamsin Fidel. Well, the pandemic has helped remove some of the stigma of going to therapy, but the work of finding a therapist tailor-made to help your issues, it can be a challenge.
Yeah, so joining us now is Dr. Alvarado, a clinical psychologist and founder of Thriving Center of Psychology. Thank you for joining us.
Thank you so much for having me.
Okay, so doctor, how does someone know when it's time to seek professional help?
Great question. My favorite rule of thumb is if you've been thinking about seeking professional help, it's probably time. But, mental health is not just for people who feel depressed or anxious. It's also for anyone who wants to improve their lives or even are at baseline and wants to even surpass that.
Right.
So what are some of the mistakes that people make when they are looking for a therapist for themselves?
Yeah, so some of the mistakes that I usually see is they usually go with the most convenient option. Some examples of that are the #1 hit on Google. Just because someone's the best marketed therapist doesn't necessarily they're the best therapist or best therapist for you. Or referred by a family or friend therapist. Just because they're really great for your family friend doesn't necessarily mean that they're the best for you. It's possible that that person was going in for something specific, or it's possible that you need something specific.
And more often now, a lot of these sessions and this process is virtual. So let's go ahead and talk about the interview step. What are the do's and don'ts to interviewing a potential therapist?
Yeah, so first and foremost, it's not a therapy session. So they're usually around 15 minutes. And so it's your chance to ask the therapist about their style and about their therapeutic process. So don't do too much of the talking, kind of give an elevator pitch of why you're coming in and let them do a little bit of the talking. Also, don't interview too many therapists. So there's such thing as analysis paralysis. So I would recommend at least 2 or 3 max therapists.
Well, that makes sense. So quality checks that people should do before paying a single penny.
Sure. So a few would include making sure that that therapist specializes in what you're looking for. Another one would be actually making sure that this therapist utilizes evidence-based treatments, so treatments backed by science. So asking them that question and then also doing a quick Google search on the therapeutic modalities that they use. A big one is, do I feel comfortable speaking with this therapist? The rapport is about, 70% of what accounts for successful treatment.
So how important is the person's first therapy experience to the overall impression of this therapy?
Incredibly important. I can't tell you how many people I've spoken to, but a poor experience with their first session and never turned to therapy ever again. So, a lot of times people generalize that first session with therapy as a whole.
So you offer what's called therapy matchmaking. How do you determine which mental health professionals are best suited for certain clients that you have?
Sure. Yeah. So we take in a few different characteristics. So one specialty, of course, and then the other piece is, who's that client feeling more comfortable speaking with, and that could be in terms of gender or cultural background, or even therapeutic styles. So we take into all these characteristics, and then have that person speak with, the potential therapist using that 15-minute consultation.
Okay, so you have something called a matchmaking quiz. Where can somebody find that?
Yeah, so you can find our therapist matchmaker at thrivingcenterofpsych.com. That's thrivingcenterofpsych.com.
All right. Thank you so much for joining us this afternoon. That's such good information for people to have, because I agree with you. If you have a bad experience one time or something that doesn't suit you, a lot of people will not go back.
That's unfortunate, too. All right. Thank you, doctor.
Thank you. Have a good one.